Hello, good day. It's Monday, January 25th, 2021, and welcome to this DPI COVID-19 update. With us is the Honorable Minister of Health, Dr. Frank Anthony. Minister, thank you very much for joining us. Getting straight into it, let's start with an update on some of our hotspot areas, more precisely two of them, regions 5 and 6.
Well, Region 5, we have been monitoring Maracabai, and while maybe about a week, 2 weeks ago, we had a number of cases in the community, we now have seen a reduction of those cases because we have been able to discharge quite a number of people who have tested positive. There are still cases in the community, and we have a medical team comprising of a doctor with a number of nurses that continues to monitor the community, and they're there since last week. They've been in the community, and we are going to keep them there for the next maybe 2 weeks or so. So with Region 5, I think, as we monitor, we'll see whether the cases increase or it's decreasing. In Region 6, the area of concern continued to be in New Amsterdam, and that's an area that we have been looking at. We have spoken about this. We've seen there probably about 32 cases in New Amsterdam. And again, we have been doing contact tracing and testing to make sure that we can get a better understanding of cases in New Amsterdam. Some of those cases that we have identified about 2 weeks ago or about a week ago would soon be up for discharge, because most of these patients have been in home isolation, and their 10 days of being asymptomatic would be coming shortly to an end, and therefore we'll be able to discharge them from home isolation. Another area of concern would be in Warramadong. We have had a team that went in there, and they did some testing within the community, and we found a number of persons who were positive. So we have been working with the community leaders and the persons in the village to get that under control as well. So we probably have about 33 cases there right now.
Okay, moving over to Region 1. That region has about 996 cases. Soon there will be the second region into the 1000s. Is the government giving some extra attention there?
I think when we look at the numbers, we have to be extremely careful. So the 900 and something cases that is being quoted would be from the time we have identified COVID in Guyana. So since last year, March, to this year, the accumulated cases would have been about 900 and something. That does not mean that there are 900 and something people that are currently active with COVID. What we have in the entire Region 1, we have about 20 cases that are active in Region 1. So that's a big difference between all the cases that we have had since COVID started in Guyana for Region 1 versus those that are currently active, which is just 20.
Okay, some additional questions from NCN. Vaccine doses are running out in some developed countries. Is that likely to impact the supply to Guyana?
There are a number of vaccines that are currently that are becoming available on the global market. The ones that are more popular and which people have been talking a lot about would be the Pfizer and the Moderna vaccine, which are mRNA vaccines. These have been used primarily in the developed countries like in the United States, Canada, the UK, EU, Australia, Israel, and so forth. And many of these countries had pre-ordered vaccines, so even before it became available, they had pre-ordered these vaccines and paid a lot of money up front. And so these companies would have to, first of all, provide those persons that have pre-ordered the vaccine, give them the vaccine first, and then they would probably be able to give to the rest of the other countries. As I said before, we have been talking and operating with the COVAX facility, and COVAX has been in contact with Pfizer and Moderna, and have been working out, negotiating to be able to get vaccines from these two companies. But that's not the only company that COVAX has been working with. They have been also talking to about 7 other companies to be able to acquire vaccines. And these companies include AstraZeneca, um, Johnson & Johnson, and a number of other companies. And more recently, at one of the COVAX meetings that I've attended, they said they're also talking to the Russians pertaining to the Sputnik 5 vaccine, and they have also been talking to the Chinese for the Sinopharm vaccine, and also the government of, well, the Indians pertaining to vaccines that are being produced by the Serum Institute. So vaccines are going to become more available on the international market. And many of the countries that are manufacturing these vaccines have given the vaccine emergency use authorization. So just like in the US, Pfizer and Moderna vaccines were given emergency use authorization, and in many of the developed countries, because this is the vaccine that they're using. The UK has also given, apart from those two, given emergency use authorization to the AstraZeneca vaccine. The Indian government has given emergency use authorization to their vaccine. And we also have, the Russians have given emergency use authorization to the Sputnik 5. Sinopharm has received emergency use authorization for vaccination in China. And now many other countries are receiving the data and registering those vaccines in their own countries. So we're seeing more vaccines becoming available other than the 2 that have been first announced and given early emergency use authorization. So we'll have to see how vaccines become available and which ones are being registered with the EU, the the WHO, and so forth. And once they're registered with the WHO, I think we can get them in Guyana as well.
Additionally, some countries are recommending the N95 surgical mask and doubling of cloth masks to safeguard against potential infections by new COVID-19 strains. Although we haven't confirmed, can we perhaps seek your opinion on this?
It doesn't have to be only N95 mask. N95 mask, you have first of all, you have different types of face coverings that you can use. What the objective here is that we know that transmission of the virus happens because of droplets and also because of aerosols. Aerosols are very tiny particles, and therefore you want to guard against that. So any face covering that covers your nose and your mouth would act as a barrier to prevent particles, whether it's droplets, to enter into the person's respiratory and alimentary system. So it's a way of physically blocking that transmission. Now, the types of material that one can use varies, and the recommendation would be, if you are in a high-risk environment, then you use material that would be appropriate for that high-risk environment. So an N95 mask is really designed to be used in high-risk environments such as a hospital, a doctor interacting with patients who we know to have COVID-19. So it would prevent those COVID-19 viruses from infecting the doctor, the nurse who is treating that patient. So that's one of your highest forms of protection, because an N95 mask would have 5 layers. Each one of those layers are designed to provide different types of protection, and that's why they're used in those high-risk environments. Then you have surgical mask or procedural mask, which is also highly effective, and in some cases they would be as effective as the N95 mask. And they are used also in more high-risk setting, again, because they have several layers, and each of those layers are designed to keep the virus out. Then you have another set of options, and these basically would be like cloth masks. And the cloth mask would, again, offer protection, especially against droplets and so forth. But they are not as protective, I would say, as an N95 mask or a surgical mask that is purposely designed to prevent viral infections, right? So they would help, and they're cheap, and they're affordable, and they're available, and therefore they would be very helpful for people to wear. So, and because most people are not in a high-risk environment, these cloth masks would work fine. So it functions as a barrier mechanism to prevent viral transmission, and because you're not in a high-risk environment, it would be protective. There are many studies that have demonstrated this, and our guidance is to make sure that people continue to wear some form of covering over their nose and their mouth. So it doesn't matter which strain or which variant we are dealing with. Once we take these protective measures, you are going to prevent transmission. Now, one of the recent 3 strains that or variants that we have been talking about, they have mutations that allow them to be more transmittable or transmissible. And that's because on the spike protein, there are mutations there that allow them, when they bind to the human cell, the ACE2 receptors, that they bind more strongly to those receptors, and that's why they're more transmissible. And so that's something that we have to bear in mind, but the size of the virus hasn't changed, and therefore the methods of transmission remain pretty much the same. And that is, if somebody cough or they talk to you, those viruses can leave their mouth and they get to the other person. So they can either do so with droplets, they can do so with aerosols, which are tinier particles, or if you touch a surface that has a droplet would have fall there and remain there, and you touch that surface, you can become infected. So that's why it's important to sanitize as well. And if you stay 6 feet from somebody, the chances are that droplets would not reach you, and you would minimize the amount of virus getting to you if the person that you're talking to is infected.
Thank you for that update, Minister. Switching over to some questions from the Guyana Chronicle, could you provide an update on samples sent to CARPA?
Well, we have sent about 10 samples to CARPA last week, and we haven't received the results as yet, but gene sequencing would take some time to do. In some cases, about 2 to 3 days to complete the whole sequence. So I suspect we'll get back the results maybe by the end of the week.
Okay. There is a spike in cases in St. Cuthbert's Mission. Are there concerns, or are you concerned over persons being reinfected?
The cases that we have seen in St. Cuthbert's Mission are really not reinfection. Reinfection would mean that that person would have had the infection in the past, and now we're getting back, being reinfected. That's not what we're seeing. We're seeing different people who are now getting the infection. And we have had some cases at the school. So we have seen children who are now infected. They weren't infected in the past, so there's nothing but reinfection. What we're seeing is new infections. And again, we have a team that went in, and they have been working with the community to ensure that we have a better understanding. We have done more testing. And again, we will be monitoring and looking at, the duration of the infection. Most of the people that we're talking about, they have tested positive, but they really have no signs or symptoms. And again, that's why we have to monitor them, just in case they develop any signs or symptoms, that we can take the necessary actions.
Minister, if we can speak a little bit about the file area and the campaign on going and or will start soon in some areas. Previously, a strategy employed by pill distributors were distributing the pills at public places, for example, markets and in schools. Will the effects of the pandemic affect the distribution of pills?
I don't think so. I think we would be able to reach the 70% of the persons that we are targeting. The ministry, the team that is working on this particular project has spent a lot of time in terms of planning and rolling out that plan. So they have a rollout that would be in some of the coastal regions, and then we go into the interior regions. And we have trained large bodies of people to be able to do so. While schools in the past had been one of the areas that we would have targeted, because students are out of school, but they're at home. So once we do the house-to-house work, we'll be able to reach those students as well. Those who are in schools, we would be reaching them at school. And we have a form that we have, myself and Minister Manik Chan would have signed, asking the parents to allow the students who are in school to take the medicines there. So this would be a good program that we are rolling out, because once we have been able to reach at least 70% of our population during this current rollout, then we would be able to get certification that we have eliminated filaria from Guyana. So that's something that we are aiming towards, but for us to achieve elimination, we really need people to take the tablets. So I'm urging persons to assist us in doing so. It is for your health. It's going to protect you. It's going to prevent you from getting filaria, or what is known as Bigfoot. And I think that's an important thing, that we can actually eliminate this disease from our country. So if we achieve that, it would be one less disease to be worried about.
And Minister Anthony, final question. Are there any new strategies being employed through this year's MDAs?
I wouldn't say new, but these have been tested strategies, and that is going from house to house, talking to people, getting them to understand why they need to take the pills. And also we have been reaching out to a number of influencers in our community, including persons who are in non-governmental organizations, religious organizations, community leaders. We have been reaching out to them, talking to them about the importance of getting people to take the pills. And I'm sure with their influence and cooperation, we'll be reaching lots of people. And hopefully we can get them to take the tablets.
Okay. Minister Anthony, thank you very much for your time, and we wish you a good rest of the day. To your viewers, thank you as well for joining us on this DPI COVID-19 update. For more updates and information, you can visit our website at dpi.gov.gy and our social media platforms as well. I am Gabriella Patram. Goodbye.